Hi everyone! Welcome to another episode of Raffles Podcast, a series brought to you by Raffles Medical Group. My name is Clinton. In today's episode, we will be discussing about psychosis. This topic is complex. It's not a diagnosis on its own, but a group of serious symptoms that are also a syndrome of a mental disorder. In general, the majority, including parents, are rarely aware of this mental health issue due to its complexities and serious nature. Therefore, patients with psychosis are seen mostly by professionals. Nonetheless, today, Dr. Anita will be helping us to understand more about psychosis with a focus on adolescents. She'll be sharing with us how to identify telltale signs and what parents can do to help their teens should they spot some of them. Hi, Dr. Anita. What exactly is psychosis?
Hi, Clinton. Psychosis is a condition that affects the mind, and this can cause a person to lose touch with reality. The main symptoms of psychosis can include seeing, hearing, or tasting things that do not exist for other people. However, these experiences feel very real to the patient. This is called hallucination. Because of these seemingly realistic experiences, the patient begins to believe strongly in them, and this becomes a delusion. Furthermore, the patient can also display other different symptoms, such as speech problems and behavioral changes. For today, we will be focusing mainly on adolescents and young adults. In some patients, rather than full-blown symptoms of psychosis, they may present with early signs or what we call as prodromal symptoms instead.
Please tell us more about prodromal symptoms. How can one identify them?
Prodromal symptoms are basically weak symptoms or warning signs of psychosis. Nevertheless, these are very important to note. Several of these signs include withdrawal from friends, family, or feeling suspicious of others, changes in sleeping or eating patterns, change in concern of appearance or personal hygiene, loss of usual interest in activities, a change in personality, as well as significant decline in academic performance, unusual ideas, or behaviors. However, picking up these symptoms can be challenging because they are very subjective and non-specific. They can also be attributed to factors such as stress, anxiety, or typical teenage mood swings that may be easily dismissed if they are not consistent. In some cases, teens may attempt to hide or disguise some of these symptoms when they feel confused, embarrassed, or afraid. Therefore, it is important for parents, caregivers, or other adults in a teenager's life to monitor closely and pick up any significant change in mood and behavior that is out of the ordinary. Encourage meaningful conversation, expression of feelings, and seek further professional help if necessary.
So, Dr. Anita, what causes psychosis?
Psychosis can be due to many different causes. Psychosis is mainly a feature of several mental disorders, especially schizophrenia, but also bipolar disorder, severe depression, or other secondary physical causes, like side effects of medications, drug or alcohol abuse, or rarely structural brain abnormalities like brain tumors. With psychosis and schizophrenia specifically, there is no single confirmed cause for early onset schizophrenia. It is likely attributable to genetic, behavior, and environmental factors. Therefore, to prevent a progression to full psychosis and later schizophrenia, although it will not happen to all and is relatively uncommon, early recognition can help to prevent further disruption to a teenager's growing years.
What is your advice to parents or caregivers if they notice some of those signs that you have mentioned?
If parents notice any significant change that are out of the ordinary in their child's behavior, getting evaluated by a mental health professional can be the first step. Parents can discuss signs and symptoms with a GP at Raffles Medical and obtain a referral for further assessment and treatment by our specialists at Raffles Counselling Centre. We are here to help. The patient will be examined and undergo an interview. Usually the initial step is to rule out any underlying medical illness that can be corrected from a series of investigations. After which, the patient will be evaluated further and receive close follow-up by either a psychiatrist or a psychologist. In most cases, at their early stages, several factors can help to prevent the progression of prodromal symptoms. If you are a parent, there are several common methods that can be significant in helping your teenager. These include ensuring that he or she eats well, exercises regularly, has a regular sleep schedule, reduce stress as much as possible, and prevent the use of illicit drugs and alcohol. There are also several approaches. For example, psychoeducation and cognitive behavioral therapy as part of the treatment plan. Overall, the mainstay is strong family support from parents and caregivers. From having a good understanding of the illness to early monitoring and intervention, this can result in positive outcomes and benefit adolescents with high risk of psychosis.
Thank you, Dr. Anita, for shedding some light on psychosis with us today. To our listeners, we hope that you found this episode useful. If you would like to find out more about Raffles Medical Group, please visit our website at www.rafflesmedicalgroup.com or follow us on our social media channels. In the meantime, be well and stay positive. My name is Clinton, and I look forward to having you listening to our next Raffles podcast.